Good morning, everyone. Hope your day is going well so far. Today we're going to talk about Chapter 6, Gingival Diseases, but before we get started on that, I just want to remind you that I have posted some stuff on Canvas in the announcements section, and I have updated the module for today, which is Lecture 4.1, to include some assignments. Those assignments have either due dates or they need to be completed at the end of your regular course time, which would be 10:15. So if you have any questions, feel free to message me or send me an email. So on to Chapter 6. Gingivitis is one of the most common human diseases and among the easiest to treat and control. However, patients often fail to recognize gingivitis because it is painless and the symptoms are thought to be normal. Patients will often say to you, "My gums have always bled when I brush my teeth." And they get a little annoyed with you when you ask them about bleeding gums. And they just seem to think that that's normal. So one approach I've used sometimes is I would say to them, well, if you had your finger bleed every time you washed your hands, would that be normal? And it kind of gets them thinking a little bit about what's considered normal. But since it is painless, it is difficult to get patients to see it. Gingivitis can be staged in 4 stages. Note the first stage, the initial stage, is subclinical. Subclinical meaning it is happening histologically or in a way that you cannot see. If you look at somebody with early stages or the initial stage of gingivitis, most of everything that's going on is going on underneath the surface, so you don't see any changes. Their gum tissue looks perfectly normal. It's flat, pink, stippled, knife-like. All the changes are going on underneath. The early, established, and advanced stages do all have clinical signs. Stage 1 gingivitis leads to Stage 2 gingivitis. The lesions begin to form 4 to 7 days after plaque accumulates in the sulcus, and it can last 21 days or longer. Note in green it says lengthened junctional epithelium is disrupted. Let me show you what that means. This picture illustrates the lengthened junctional epithelium is disrupted. In healthy gingiva or stage 1 gingivitis, the first picture shows the attachment of the junctional epithelium to the tooth right at the CEJ. So you can see how the tooth, and then you can see where the CEJ is. Right there is where the junctional epithelium is attached. And it works its way, it's completely attached coronal to the CEJ. If you look at the second picture in stage 2 gingivitis or early gingivitis, the junctional epithelium is starting to detach a little bit, and if you were to stick a periodontal probe in there, you would get a little bit deeper of a probing depth as the junctional epithelium detaches. And it's also becoming thicker. But the base of the junctional epithelium is still connected at the CEJ. In established gingivitis, or the third picture, stage 3 gingivitis, you can see how the junctional epithelium is continuing to disrupt. It is still attached at the CEJ, but it's getting thicker. And then in the fourth picture, you can see that it's no longer attached at the CEJ. It's been completely disrupted. This is a picture of what the early gingivitis would look like clinically. The clinical probing depth increases for two reasons. One, the periodontal probe penetrates more deeply through the junctional epithelium into the connective tissue. If you look at picture B, it shows the periodontal probe going through the junctional epithelium into the connective tissue. Or, edema in the tissues moves the gingival margin coronally, increasing the probe readings. So if you look at these three pictures, the first picture is healthy, and assuming this little black mark is the periodontal probe, it would only go in about 2 millimeters before it hits the junctional epithelium attachment. Picture B, where there's a little bit of gingivitis going on, you can see the junctional epithelium has gotten shorter. It's gotten just a little bit lower on the tooth, and you can see the periodontal probe would probably go in about 4 millimeters at that point. In picture 3, or picture C, you can see that the junctional epithelium has gotten a little bit shorter even, and that the periodontal probe would go in a lot further. Notice how inflamed or how swollen or bulbous looking that tissue looks. Gingivitis is reversible, and with good home care, the patient should have no residual tissue destruction. Gingival recession refers to location of the gingival margin. The gingival margin would be below the CEJ in gingival recession. These are the causes of gingival recession. Describing your gingival condition. This would be like your gingival description you do in clinic. You're going to start with the extent of the involvement. Is it localized or generalized? The division between the two is, they guesstimate about 30%. If it's under 30%, it's considered localized. If the condition is affected more than 30% of the gingiva, then it would be considered generalized. If you're going to use the term localized, you always must put where it's localized to. Is it papillary, marginal, both? Diffuse, meaning does it go all the way to the mucogingival junction? Is it slight, moderate, or severe? Chapter 6, Gingival Diseases, in your textbook on page 73, box 6.1, gives you the list of the 1999 classifications of periodontal diseases and conditions. That is what we are going to be studying in the rest of this presentation and what you'll be quizzed on. Please note that in 2017 they've revised those classifications, and you will get to learn those too at a later date. This is what the 2017 classifications look like. You may be familiar with this as you've seen those laminated charts in your op in clinic. Gingivitis associated with dental plaque only is directly related to the plaque accumulation without other local contributing factors. It's the most common gingivitis.